Hello, everyone, and welcome to our 5-minute medication review. Today, we're going to be going over dexamethasone sodium phosphate. So, the trade name for dexamethasone is Decadron. Its classification is a corticosteroid and anti inflammatory. So, the way that Decadron works is it improves lung function and myocardial performance. It stabilizes lysosomal and cell membranes, basically by the inhibition of complement induced granulocyte aggregation. And basically, what that means is a granulocyte is a type of white blood cell with granules in it. And basically, what this does is it prevents those white blood cells from clumping together, which can damage vessels. It also causes a rightward shift in the oxygen hemoglobin dissociation curve. That's a fancy way for saying basically this is when we have a rightward shift in this oxygen hemoglobin curve. It basically it's easier for hemoglobin to release oxygen to tissues. And then also it creates the inhibition of prostaglandin and leukotriene production, which in essence will its effect is an anti-inflammatory effect, and it increases in surfactant production, decreases pulmonary edema, which we want, and relaxation of bronchospasms. So its indications is for reactive airway disease, so acute exacerbation of bronchial asthma and anaphylaxis. So it's absolute contraindication. So when we wouldn't use this is for systemic fungal infections, preterm infants, and a dexamethasone allergy. Precautions and side effects, if given IV, it should be given as a slow IV push. So, sodium retention and fluid retention are some side effects of this: potassium loss, hypokalemia, alkalosis, hypertension, convulsions, hyperglycemia, myocardial rupture following recent myocardial infarction. So, it does have some pretty significant side effects. The way that this drug sits, we do not carry this drug in our drug boxes, but there may be some other agencies out there that do. Our administration of this drug, if we were to carry it, would be IV, IM, or IO. Its onset is 4 to 8 hours, so it takes quite a bit of time to give this medication, to have its effect. Its peak effect is 6 to 12 hours after administration. Its duration is 24 to 72 hours. So you're really not going to see an immediate effect. The drug that we do carry that is similar, another corticosteroid, is solumedrol, in which we'll talk about in another video. But its indication for Decadron here is bronchospasms due to asthma and obstructive lung disease. We would give zero point 0.6 milligrams per kilogram of a patient to a max of 10 milligrams, and for stridor. Thank you for your time. I hope you learned something about Decadron today, and thank you.